surge in MPox cases in South Africa starting to raise concerns, and you heard Ngobile Madlala talk to us about some of the measures that the Border Management Authority is engaging in to ensure that there is detection even at our points of entry. We heard the Health Department not too long ago as well explain what some of these symptoms are and who are those who have so far been affected, infected, and those who have actually unfortunately succumbed to the disease. And we thought we'd pick up that because it is important to continue to share good, credible information with the public on what MPox is, how it's treated, and what the prognosis is as a country to ensure that there aren't a great deal more infections of MPox. And Dr Richard Lessells is an infectious disease specialist based at UKZN and joins us now. Dr. Lessells, good morning to you, and thank you very much for your time. It's always good just recapping and repeating for the benefit of the public exactly what MPox is, how it's detected, and what its treatment regime is, and what the expectations are in terms of managing this. And we'll talk about a vaccine as well a little bit later on. But again, let's just start with concerns around the presentation. How do I know if I have MPox, and what should I do?
Yeah, good morning, and good morning to everyone. I mean, MPox is a virus infection that typically causes skin lesions, and that can be a rash with multiple skin lesions, or actually what we see in the outbreak that's been happening in the past couple of years is that can sometimes just be one or a few lesions on the skin. And classically, it also causes kind of a fever and headache and tiredness. But in the outbreak in the last couple of years, those symptoms are not always present. So the key characteristic sign is the skin lesions, and they can happen anywhere on the body. But because of the way that the virus has been spreading in the outbreak in the past couple of years, those lesions can sometimes be found around the genital areas, around the bottom, or even around the mouth and inside the mouth. And so these are things that people should be aware of. But particularly, we need to get the message out and the awareness up in the particular group that seems to be at higher risk, and that's gay, bisexual, and other men who have sex with men, because that's the group predominantly being affected in the global outbreak of MPox, and it seems also the group at highest risk here in South Africa.
Why is that, Dr. Lessells?
So it's just a way that the virus has found to spread from person to person. It spreads from these skin lesions, from the rash, wherever they are on the body, and it spreads through very close contact. And that is happening through sexual encounters, because that's when two people get most closely together, and the skin-to-skin contact, or what we call skin-to-mucosa contact. And mucosa is what lines our mouth, lines our bottom, lines our genitals. And so sexual transmission has become the kind of main way that this virus is now spreading in South Africa and around the world.
So there are serious presentations of the disease, and there are milder presentations of the disease. Talk to us about how we embark on treatment for both of those scenarios.
Yeah, you're right. There's a range of severity, and we've seen that in the small number of cases here. We've unfortunately had cases towards the more severe end of the spectrum, and 2 cases that have unfortunately died. Now, the reason for that is that in most people with healthy immune systems, the infection is relatively mild. It may make you feel unwell for a couple of weeks or so, and then the skin lesions will heal and disappear. Unfortunately, in people with very weakened immune systems, and in our context, that is largely people with what we call advanced HIV. So that's people with HIV who are not on effective antiretrovirals and have very low CD4s. The disease can be very different in this group, and it can be much more severe. They can have additional complications of the disease, and that what unfortunately can sometimes lead to poor outcomes and to death. And this is the group that will often require drug therapy and treatment. And so far, we've been able to obtain treatment for the more severe cases in South Africa.
So the conventional wisdom, in a way, based on what you're saying, is that if you are not on HIV or antiretroviral treatment, you should get on it, because in the way that it insulates or improves your immunity, it will increase your chances of not, obviously barring the sexual contact, will increase your chances of not contracting this disease.
Yeah, I mean, it's not so much that they're at increased risk of acquiring the infection, but it's that if they do acquire the infection, the disease is much more severe, and they're at much higher risk of being hospitalized and of dying. And so you're quite right. I mean, it's in a way a key public health message for all South Africans to know your HIV status. If you're HIV positive, to be on treatment, and if you're on treatment, to know that your viral load is suppressed. But each of these new infectious disease outbreaks that happens, whether it's COVID, whether it's MPox, whether it's something else, they're a reminder of this message that to prevent severe consequences of other infectious diseases, it's critical to know your HIV status and to be on effective treatment. And that's your best chance of reducing the risk of being unwell, being really unwell, being hospitalized with infections like MPox.
I know we're oversimplifying things, but for those who might wonder, well, what is a skin lesion? What does it look like? Just maybe a very quick explanation on that, or description of that.
Yeah, so they can look quite different. I mean, classically it kind of starts as a little bump on the skin and then becomes kind of filled with fluid. So what we might call a little blister on the skin, where you can see that there's fluid in there, and then they can become larger kind of fluid-filled bumps on the skin, and then they start to kind of heal and crust and then kind of completely heal. But again, in the outbreak that we see, people can present at different stages and with different types of lesions. So there's not kind of one classical type. And so if people are have a concern that they may have been exposed, or they may be in the group that is at high risk of being exposed, and they have any type of skin lesion, particularly on the body, around the genitals, around the mouth, then they should seek medical attention and get it checked out.
Talk to us about a vaccine, and in fact, maybe two things, because I've only got time to wrap two things up. Maybe let's go back to the investigation around the source. How important is it to know the source of the outbreak in South Africa? The obvious reason would probably be so that we can manage, where it's coming from or emanating from. So what are those investigations likely to look like in being able to pinpoint that?
Yeah, I mean, it's critical to understand how it's spreading and which group is most at risk. And as I say, at the moment, the understanding is that it is in quite a confined group within the population, and that's consistent with what we've seen in the global outbreak. And it's critical that we keep an eye on that, and obviously that requires very rigorous investigations with each new case, contact tracing that we're familiar with, so trying to understand who else might have been exposed, who else might be infected. That's critical to understand, does this remain within that high-risk group, or do we start to see spread into other groups within the population? Because that's key to then controlling and preventing this becoming a bigger outbreak. And you're right, vaccines may have a role as part of the public health response in protecting the people at highest risk. And there are moves at the moment to try and get some vaccines into the country and to then decide how to deploy those to protect the people who are at highest risk of being exposed, and also those at highest risk of becoming very unwell, as we've discussed.
Do we have the drugs that we need, Dr. Lessells, to treat this? I know that there is some MPox specific treatment that has already been sent to South Africa, or which is in now the hands of the health department for those who are experiencing severe health conditions. Just talk to us a little bit more about the treatment regimen and whether it also works well with existing ARV treatment.
Yeah, so there's a drug called tecovirimat, and as you say, that's been obtained kind of on an individual patient basis for some of the cases with the most severe illness with MPox. And I think we now have a kind of small supply that can be used for additional cases should they need it. And that's really for the people with the more severe disease in hospital, or the people who we think are at high risk of developing severe disease. So that would be the group we talked about, people not on effective antiretrovirals. And generally, yes, this drug's given for a couple of weeks. Generally, it's quite safe and well tolerated, and it should be okay to take that if a person is on antiretroviral therapy for their HIV. If the outbreak does expand, then clearly we need to find ways to get a kind of larger supply of this treatment into the country, get it registered in the country so that it's easier for doctors to treat people with MPox should they need treatment.
Dr. Richard Lessells, thank you very much for talking to us and sharing that very important information. And Dr. Lessells is an infectious diseases specialist.